Psychiatric medications, a comprehensive guide for naturopathic practitioners. Psychiatric medications, including antidepressants and antipsychotics, are used to treat mental health disorders. There are 5 main types of psychotropic medications, and each type has its specific uses, benefits, and side effects. Knowledge of these medications is indispensable for naturopathic practitioners working with patients experiencing psychiatric conditions, ensuring comprehensive and holistic care. Antidepressants treat mood disorders via different neurotransmitter regulation mechanisms. Selective serotonin reuptake inhibitors, SSRIs. SSRIs like fluoxetine increase serotonin availability, improving mood. Nausea and sexual dysfunction are common side effects. Patients should report mood changes or suicidal thoughts. Serotonin norepinephrine reuptake inhibitors, SNRIs. Venlafaxine, duloxetine, and others affect serotonin and norepinephrine reuptake, with similar side effects to SSRIs and potential blood pressure elevation. Ibupropion. Bupropion promotes important brain activity and can alleviate symptoms of depression. It's also used to treat seasonal affective disorder, SAD, and aid smoking cessation. Common side effects include drowsiness, insomnia, constipation, weight gain, sexual problems, tremors, and dry mouth. Tricyclic antidepressants, TCAs. TCAs like amitriptyline impact serotonin, norepinephrine, histamine, and other receptors, causing side effects such as dizziness and dry mouth. TCAs are used when other antidepressants fail, with hydration and OTC treatments for side effects. Anti-anxiety medications. These medications address a spectrum of anxiety disorders, including panic attacks, phobias, generalized anxiety, and related symptoms. While pharmaceutical anti-anxiety medications may provide short-term relief, naturopathic practitioners emphasize addressing the root causes of anxiety through lifestyle modifications, mental health therapies, dietary changes, detoxification, and herbal remedies. Common examples of anti-anxiety medications include SSRIs, SNRIs, benzodiazepines, and beta blockers. It's essential to consider individual factors such as underlying imbalances, stress levels, and lifestyle habits when determining the appropriate course of action and the potential side effects of anti-anxiety medications. Benzodiazepines, BZDs. Benzodiazepines are a class of medications known for their calming effect on the central nervous system, CNS. They act by enhancing the inhibitory neurotransmitter GABA, inducing sedation and relaxation. BZDs are prescribed for various conditions such as insomnia, anxiety disorders, panic attacks, and alcohol withdrawal. Widely prescribed examples include alprazolam, Xanax, diazepam, Valium, and lorazepam, Ativan. Common side effects include drowsiness, dizziness, and sleepiness. Long-term use can lead to psychological and physical dependence, with withdrawal symptoms resembling those of alcohol withdrawal. Beta blockers, B blockers. Beta blockers help manage conditions like increased heartbeat, chest pain, and high blood pressure, nausea, sweating, and trembling. Beta blockers work by calming down the effects of epinephrine on the heart and blood vessels. Epinephrine, or adrenaline, is a hormone that prepares your body for action or a fight-or-flight situation and can cause physical responses to anxiety, such as a fast heartbeat or tremors. Beta blockers such as Inderal, propranolol, and tenormin, atenolol, are also sometimes used to treat certain types of anxiety, although they have not been approved in the US for use in people with this condition. Nausea, slowed heart rate, blurry vision, lightheadedness, headaches, confusion, fatigue, low blood pressure, and nightmares are potential side effects. Patients should be monitored regularly and encouraged to report side effects. Stimulants are prescribed to improve concentration and have an alert but calming effect on the nervous system, often prescribed for ADHD. Insomnia, decreased appetite, and weight loss are common side effects of stimulant medications. While legal stimulants like caffeine and nicotine are commonly consumed, illegal substances like cocaine and methamphetamine carry significant health risks and are incompatible with naturopathic principles. Stimulants increase neurotransmitter activity in the brain, but their long-term effects and potential for addiction make them incompatible with holistic health practices. Side effects may include insomnia, nervousness, and cardiovascular issues. Healthline's 2023 list of stimulants includes amphetamines, methamphetamine, methylphenidate, and dexmethylphenidate. Amphetamines. Amphetamines are stimulants used for ADHD. They include amphetamine, dextroamphetamine, and lisdexamphetamine. Brand names of these drugs include Adderall XR, Dexedrine, Dianavel XR, Evakeo, Procentra, and Vivans. Methamphetamine, Disoxin. Methamphetamine is related to ephedrine and amphetamine. It also works by stimulating the CNS. Methamphetamine may increase the amounts of hormones like dopamine and norepinephrine in the brain. Like other stimulants, it can reduce appetite and increase blood pressure. Methylphenidate. Methylphenidate works by blocking the reuptake of norepinephrine and dopamine in the brain. This helps increase levels of these hormones. Brand names include Aptensio XR, Metadate ER, Concerta, Daytrana, Ritalin, Ritalin LA, Methylin, Quilichew, and Quilivant. Dexmethylphenidate. Dexmethylphenidate is another stimulant for ADHD that's similar to methylphenidate. It's available as the brand name medication Focalin. In naturopathic medicine, we advocate for natural approaches to enhance focus and energy and address concentration-related conditions, such as optimizing nutrition, getting adequate sleep, and incorporating herbal supplements like DHA and EPA essential fatty acids, ginseng, and rhodiola as natural alternatives to these drugs. Antipsychotics manage psychosis, characterized by delusions or hallucinations, aiding in clearer thinking, improved sleep, and enhanced communication. They are used to treat conditions such as ADHD, depression, PTSD, OCD, and eating disorders. Drowsiness, upset stomach, increased appetite, and weight gain are potential side effects of antipsychotic medications. Mood stabilizers regulate extreme emotions, primarily used for bipolar disorder and mood swings. Potential side effects include upset stomach, drowsiness, weight gain, dizziness, tremors, blurry vision, and confusion. Combining psychotropic medications with alcohol or illicit substances can be dangerous. Use caution when driving or operating machinery if medications cause fatigue or drowsiness. Women should consult their doctor regarding medication risks during pregnancy, breastfeeding, or potential conception. Gradually discontinue rather than abruptly stop medications to avoid withdrawal symptoms and severe side effects. Contact a healthcare provider immediately if experiencing adverse allergic reactions like fever or rashes. Older adults may be more sensitive to medications, requiring careful dosage adjustments and monitoring for interactions or side effects. Monitor your patients for harmful or unwanted side effects of psychiatric drugs and consider safer alternatives. By understanding the classification, mechanisms, and considerations of psychotropic medications, individuals can make informed decisions and collaborate effectively with healthcare providers to optimize mental health treatment outcomes. Several patient factors, such as age, weight, and genetics, can influence drug response and susceptibility to adverse effects. Considering these factors when prescribing or recommending medications allows for personalized treatment plans tailored to individual patient needs. Adverse drug reactions, ADRs, can range from mild to severe and sometimes life-threatening. Recognizing potential ADRs, monitoring patients for adverse effects, and implementing appropriate interventions are essential components of safe medication management. Contraindications. Naturopathic practitioners must be aware of contraindications when recommending dietary supplements or herbal remedies. For instance, certain supplements may be contraindicated in pregnancy, breastfeeding, or specific medical conditions, such as liver or kidney disease. Natural alternatives. Explore natural alternatives such as herbal remedies, homeopathic remedies and flower remedies, dietary modifications, and lifestyle changes to complement or take place of pharmacological medications. Individualized treatment. Tailor treatment plans to address the unique needs and preferences of each individual, considering their holistic health and wellness goals. Collaborative approach. Encourage collaboration between naturopathic practitioners and conventional healthcare providers to ensure comprehensive and integrated care. Mind-body connection. Emphasize the importance of mind-body practices like meditation, mindfulness, and breath work in supporting mental health and well-being. Comprehensive patient assessment. Conduct a thorough patient assessment, including medication use and history, dietary habits, and supplement use, to identify potential interactions and contraindications. Individualized treatment plans. Develop individualized treatment plans that consider potential interactions and contraindications, ensuring safe and effective care. Patient education. Educate patients about food-drug supplement interactions to empower them to make informed decisions about their health and treatment options. Interdisciplinary collaboration. Collaborate with other healthcare providers, such as physicians and pharmacists, to ensure coordination of treatment approaches. Drug information database resources. Refer to drug information database resources to determine pharmacological indications, contraindications, side effects, and interactions. Monitor patient progress. Regularly monitor for drug supplement interactions and assess the patient's response to treatment. Adjust treatment plans as needed. As a naturopathic practitioner, it is essential to possess a profound comprehension of conventional medications and their potential interactions with food, supplements, and other drugs. Patients increasingly seek safer and more natural alternatives to medical drugs, making it imperative for both holistic and medical practitioners to ensure the safety and well-being of their patients. In conclusion, integrating pharmaceutical knowledge and incorporating the wisdom of food-drug supplement and drug-to-drug interactions and contraindications into clinical practice is essential for naturopathic practitioners to deliver safe, effective, and holistic care to their patients. By understanding how various substances interact within the body, naturopathic practitioners can optimize treatment outcomes, minimize risks, and promote the overall health and well-being of their patients. By utilizing a combination of resources, such as drug information databases, regulatory agencies, professional organizations, medical journals, continuing education opportunities, drug reference apps, professional networking, and textbooks, practitioners can stay informed and provide comprehensive care to their patients. Through ongoing education, interdisciplinary collaboration, and patient-centered care, naturopathic medicine continues to evolve as a trusted and effective approach to healthcare. Be sure to review the resources and strategies provided in this module to help naturopathic practitioners stay informed about pharmaceuticals and their interactions.